Thank you, Matthias. Sorry about that. And thank you all again for joining today's webinar brought to you by the Tribal Law and Policy Institute. As I mentioned, today's webinar is titled Strengthening Tribal Codes, Integrating Victim Advocacy and Elder Protections, and will be presented by Bonnie Claremont, Victim Advocacy Specialist with the Tribal Law and Policy Institute. And now I will turn it over to Bonnie to introduce herself and get us started. Thanks, Bonnie.
Yes, thank you, Catherine. Yes, good morning, good afternoon, wherever you are. I'm based in St. Paul, Minnesota, where I work for the Tribal Law and Policy Institute, as was stated earlier. And I just wanted to, I'm a citizen of the Ho-Chunk Nation, first of all, originally from Wisconsin. I grew up here in St. Paul, Minnesota. I also wanted to just have some context for my part in this webinar. I'm not a lawyer, and I came to the Tribal Law and Policy Institute about 20 years ago, where I opened an office here in Minnesota. And prior to coming to the Institute, I worked as an advocate for many years, probably about 20, 25 years, as a domestic violence, sexual assault advocate, and also worked on issues related to all forms of abuse, primarily directed at our Native people. So that's the context for which I do this work. So ironically, when I came to the Tribal Law and Policy Institute, one of the first trainings that I participated in was in code development for a tribe in Michigan. And I thought, why am I here? I'm not a lawyer. I'm not a trained lawyer. Why am I here, doing this? And it became really clear that as we help tribes across the country develop their codes, oftentimes those codes are addressing issues related to violence or abuse. And it's important to have the voice of those working with victims like that. So the co-development work, fortunately, TLPI really supported my work in helping tribes have the advocacy piece and the victim-centered piece within the code development work that we were doing. Also, the tribal codes that we help tribes develop is really focusing on the importance of maintaining tribal sovereignty and incorporating tribal custom and tradition into the code work. So that's just the context for which I'm doing this presentation. So I'm not a lawyer. Any questions that you might have that are specific to legal language and so forth, probably I'll save for those that are law trained. So I just wanted to add that a little clarification. Next slide. So these are some of the topics that I'll be covering, just providing an overview, talk about reporting the abuse of elders and some of the cultural considerations that need to be held and also incorporated into our codes, elder abuse services, and I'll be discussing some of the more emergent needs of elders, supporting victims and the non-offending family, and also any long-term care of elders and how that's important and can also be written into code, collaborating to protect our elders. And also the use of elders in any code development work, I think, is also really important. From my understanding, there's probably less than 50 tribes across the country of our 500 and I want to say 74 tribes, federally recognized tribes at the present time who actually have elder abuse code. So that's not very much. That's like less than 10%, which is to me really strange. And I think I got this information maybe from one of the sites that where I have a lot of the information for this presentation. I can't remember exactly, but I got that figure somewhere. Next slide. So I think we missed a slide. So there's a lot of different aspects when we go on site to do elder abuse co-development work. Oftentimes we're there for more than a day. I think, of course, doing co-development work with any tribe can take a lot of time if you want to do a really comprehensive job. But these are some of the content within a tribal elder abuse code. This is just an example. One of the things that I don't see on here is the importance of incorporating custom and tradition into the code. So language like, you know, any action taken shall be conducted in a manner which is consistent with custom and tribal tradition and beliefs. So stating that within a code, I think, is really important because that's part of, the language of the importance of our tribal sovereignty. It's what sets us apart. So any code development work that I'm involved in, I always encourage tribes to not just take sort of a state law or a federal law and adopt that or adapt that, but really look seriously at incorporating custom and tradition. And oftentimes that may require the use of tribal elders, for example, so that your custom and tradition are adequately represented in a code. So, for example, I can't cover all of these different aspects because each one has its own specific languages, and again, incorporating custom and tradition. I believe I have an example of policy, though, coming up. Next slide. This is an example from a local tribe here in Minnesota. It's the Mille Lacs Band of Ojibwe, and this is taken from their elder abuse protection code. And they incorporate a lot of their own custom and tradition into this policy statement. But I love it that they put it very early on, which I think is really important in any kind of co-development, is to have policy and also purpose of a code where they can put right up front the importance of why this code is important. So they list elders as a valuable resource to the band because they are repositories and custodians of tribal history, language, culture, and tradition. And they are the best hope of the band to pass on the tribal history, language, culture, and tradition to its children. Thus, the interests of the band now and in the future are advanced when its elders can be confident they are protected from abuse, neglect, and exploitation, and are free to fully participate in the activities and proceedings of the band. I love this. I love that they have this policy. Similarly, the band recognizes the need to care for and protect the most vulnerable of its members, including those who suffer from mental or physical impairment. So this is some of what's contained in, they put this right up front and then also follow it up with all of the language in the code. Next slide. The Quileute tribe, had a chance to visit them years ago to help them with their code. And this is a language taken from their code about the need for an elder abuse code. And it's part of their, I believe it's a family code where they also have tribal codes around child abuse. So they put those together and they recognize that elders and children are probably their most vulnerable citizens. So again, they say the same thing. The Quileute tribe recognizes that the elders and the young people are the tribe's most important resources. And then they have a listing of the rights of elders, and they list several rights, but I took the first one, which says children, elders, and families have the right to live free of physical, emotional, cultural, financial, and spiritual harm and or neglect and sexual abuse or exploitation. Okay, next slide. So Of course, before colonization, we didn't have written codes. It was um, beliefs and uh, ethics that guided us, cultural custom and tradition that guided us in how we were to treat one another, and particularly the respect that we held for elders. We had the utmost respect for elders as keepers of tradition, stories, customs, language. Elders' needs were everyone's priority. So, it was up to everyone within the tribal village to protect elders, because they were holders of our custom and tradition. We had no nursing homes, of course. Today, more tribes are developing their own, setting up their own nursing homes. And even there, though, you know, there's a need for training and um, rules and policies to protect our elders that need to be in care facilities like that, because more and more I'm hearing stories about elders who are being neglected because of short staffing, in particular from COVID even. So again, the policies and these codes also apply to people who work in care facilities. um, Grandparents helped raise grandchildren. That was, families lived where, in a home where there were not just, the immediate family, but, as the elders got older and needed more help, they were brought into the home to take care of, because there were no nursing homes, but also because they were there to be able to teach the children, the grandchildren, great grandchildren. At that time, life expectancy uh, was where people live longer lives, and of course, then we had more elders that needed the care. Leaders were the center of our nations. Our elders were the center, and they were our gatekeepers. They were the ones that, sort of kept us in check, right? Because they knew the custom and tradition and how, uh, the principles of daily living, even how we were to take care of ourselves, take care of our children, of one another, to look after one another in our villages. So they were our gatekeepers. They sort of talked about the different rules and so forth about how we were to live in peace and harmony with one another. Next slide. So definitions. What is elder abuse? Next slide. Most elder abuse is defined in the acts, or the failure to act, within the codes. So this one here is taken from the National Center on Abuse, on Elder Abuse. Acts or failure to act by persons required to act, resulting in harm to an elder or frail or vulnerable adult, which may or may not be criminal. So this is more focused on civil, of course, but within any code, there's going to be that criminal liability that, if any incidents of abuse and so forth, also is shared with law enforcement, to initiate an investigation to see if there was any criminal liability. And then also, of course, the codes include the mandatory reporting requirements, which I'll discuss here in a minute. Next slide. So this is where elder abuse is further defined in most codes, where it says a person is guilty of elder abuse if they knowingly and willfully commit any of the following. So most codes are listed based on these different types of abuse, of physical abuse, and what constitutes physical abuse, right? So the language is pretty detailed about what consists of physical abuse and sexual abuse. Um, so, it in most codes that I've seen, it discusses physical contact of a sexual nature. Some of the codes also include what parts of the body are included when that physical contact happens, for example. Um, Also, emotional or physiological abuse, neglect, self neglect, abandonment, financial or material exploitation, and spiritual abuse. And when you look at a lot of codes from other jurisdictions, other, non-tribal, um, oftentimes there's not a spiritual abuse component. And I think this is really important that, tribal codes include this. And it's spiritual abuse for our elders. They're accustomed, many of them are accustomed to participating in our traditional ceremonies, for example, and it's often really difficult to um, for elders to get there because of their physical limitations. In a lot of places where the ceremonies are held may not be fully accessible. So I think that's another thing that advocates can do, is to work with their programs and really advocate for greater accessibility, physical as well as even materials that are developed so that they're in compliance with the ADA, so that elders can read, the print is bigger. All of those things I think are really important to really protect our elders so they have access to things like spiritual ceremonies. So language within this code is important, like spiritual abuses when an elder is being denied access to ceremonies or traditional healing. Because a lot of caregivers may not want to, go through all of the problems of, transporting and making sure the elders can get into a place where spiritual ceremonies are being held, like if it's outdoors. And oftentimes wheelchairs may not be able to get into the ceremonies, for example. So, but when it's possible, oftentimes caregivers just don't want to do that, and it gets to a point where the elder is having a really difficult time because they feel that part of their life is really important, right? So, I think it's good to include this within our tribal codes on elder protection. Next slide. So these are the most common forms of abuse. And I put neglect at the beginning because in a lot of the cases that I see happening across the country, most of it is really around neglect, where, you know, leaving elders alone for extended periods of time, not attending to their physical needs for hygiene and so forth. There was a study done by the Navajo Nation quite a few years back, and this was one of the areas that was happening most frequently, is neglect. So being denied food, medicine, companionship, bathroom hygiene assistance, medicine, not just the, prescription medications, but also medicine that they are more accustomed to using, our traditional medicines, for example. Exploitation, exploiting elders, unreasonable imposition on the elders' time, leaving children with elders for extended periods of time where that elder may not be physically or mentally able to care for the children for, a longer period of time than what they are capable of. So abandonment, more and more seeing elders, left in their homes when they're not physically able to be left alone for a period of time. Breach of fiduciary duty. If we have someone who has power of attorney and they're misusing that elder's financial income, for example, because so many of our tribes are, our tribal members and tribes are providing per capita payments, for example, and that just increases the possibility even more of our elders being exploited financially. So it's important that the the caregiver is responsible and that there's some vigilance over that from people who have contact with elders to make sure that they are that they have some control or they have control over their financial situations, because oftentimes they're brought up in that kind of practice of sharing and helping your children or helping your grandchildren, and oftentimes that can be exploited. So it's so important for anyone having contact with elders to see if there's any exploitation happening. Next slide. So who is an elder? I think I'm seeing this age getting younger and younger, and perhaps maybe because of life expectancy now. Um, so I just took this one from the Mille Lacs. Elder is a person subject to the jurisdiction of the Mille Lacs band of Ojibwe who is at least 55 years of age. That's pretty young, in my in my estimation. But again, it's up to each tribe to determine that. Next slide. And a lot of the age will also, according to, tribal services that are provided, elders, whatever age that the tribe determines that that number to be, that's when they become eligible for tribal services, for example, and may be given priorities for different kinds of services, including being able to um, live in particular kind of housing or having people come to their home to provide, maintenance kind of work to make sure their driveways are plowed and so forth. So a tribe can determine that to be at any age. So the Quileute tribe, for example, theirs is at 50 years of age. When I go and talk with, as I'm there talking about elder abuse, um, we've had a lot of discussion with tribes, or I have, and they say, age didn't always determine, who is an elder, who can be defined as being an elder status. It was more determined by life experience, wisdom, and the respect that people may hold for an individual, for that person, because there's often talk about, how some elders who are committing crimes even against, maybe, for example, against children, who are sexually abusing children, and also have to be held accountable. So there's discussion even in that sense as well. Next slide. Of course, Medicare and social services say 65. So just have to include that as well. Um, so who are the people who are abusing elders? And it's primarily caregivers. So, tribes can define who those are, right? Um, and often I've seen, and I don't know if I have an example, I can't remember. Um, it could be spouses, it could be adult children, family, nursing homes, like I said earlier, senior care facilities, even there's care facilities just for the people who have memory impairments, caregivers of all types, others in professional capacity, people who are, providing services to elders who, our tribal aging unit. They have people who are in contact with our elders to provide services. So any of these can also be responsible for abusing an elder, right? Whether we're talking about verbal abuse or other types of abuse. Community members can also be, um, perpetrating abuse. Generally, it isn't strangers, and but it can happen. Okay. So so caregiver often can be written in tribal code as a person who is required by tribal law or custom to provide services or resources to an elder, a person who has voluntarily undertaken to provide care, um, to provide oh, I'm trying to read this from my notes. I just added this to provide services or resources to an elder, an employee of any institution or agency specified within this code. So, including those, anyone, like I said, who has responsibility for the care of an elder. And oftentimes that's required. They include the wording of required by tribal law or custom, right? Okay. And also, I want to say that, tribes also have agreements with state or other agencies to provide some of the services. So, also these codes can impact them to hold them accountable for any abuse that's being perpetrated against our elders. Okay. Next slide. There are so many risk factors. Um, and I just included a few here. Elders who suddenly become dependent, elders who are mentally confused, have dementia, or maybe have been diagnosed with Alzheimer's, or maybe they're in the process of being tested for any of these. Women, we still see the data that reflects women as being victimized by many different types of abuse. So women in this country are still among the most vulnerable for abuse and violence. Elders living with primary caregivers, added demands on caregivers and their responsibilities. So there's that potential that, with all the daily demands on um, adults that are caregivers, the demands of work, demands of, their own financial stress, their financial obligations and responsibilities, the care of their own children, other things that they may be involved in the community and so forth, that there's less and less time for them to take care of an elder, and yet they may not, be at that place where they want to seek outside intervention or resources to help them take care of their elder, much less to put them in a care facility. That's for a lot of our Native families, that's something they really want to avoid. Just because of tribal custom and tradition. We are supposed to take care of our elders, but yet, at what point do you get to where um, you say, I just don't have the time to do that anymore? And with, you know, still wanting to uphold that belief or tradition, those are difficult times where oftentimes as an advocate I will suggest that they have a family meeting, for example, to see what's the best solution here. So the more outside involvement you have with other family members, extended family, I don't like using that term, but family members of the elders, include them. It's where abuse happens, where there's a lot of sort of exclusion of other people coming into the home, and because that caregiver may not want anyone to know that they're exploiting or they're abusing an elder. So the more involvement you have with other family members, the better, right? Because, like I said early on, it's everyone's responsibility. The care and protection of our elders is on everyone, is on all of us. So I always say, it's important to involve everyone, have a family meeting, and discuss what's the best option, the best uh, you know, course to take to make sure the elder is provided for and well taken care of. And also, we're seeing rates of violence increase in our communities because of the drug abuse problem that's happening, and where there's the need to pay for the drug and their addiction to cover those costs as well. So there's an increasing concern that elders can be financially exploited because the caregiver has an addiction that has to, where they're looking to, pay for the addiction, whether it's um, a drug or gambling or whatever the addiction might be. Next slide. So personal problems of the caregiver. Of course, everyone has their own problems, whether it's they have a physical condition where it's making it more and more difficult for them to provide care for the elder. The poverty, of course, still many of us and our families live in poverty in our tribal communities, and there might be a more of a greater reliance on the elder's financial income. Drug problem, like I discussed earlier, and just simply lack of awareness of the problem. And where, like I said, where isolation happens and it becomes sort of secret, there's a lot of secrecy around it. That's where we need to be much more vigilant, and those that have contact with elders should be more vigilant. So in any code, in any tribal code, there's language around the duty to report abuse or neglect. And this one, again, I took from the Mille Lacs tribe, um, that there's reasonable cause, right, to suspect. So anyone who believes there might be abuse happening shouldn't investigate, right? You don't put your investigator hat on. If there's reasonable cause to suspect, then it should be reported if you're a mandated reporter in particular. So in a lot of codes, they often list who the mandated reporters are. And I'm always impressed that, oftentimes that looks different than it does in non-tribal jurisdictions, right? Because often they'll even list tribal leaders are mandated reporters. And I love that. It's like it puts a burden of responsibility also on our tribal leaders to be aware of what that is, what constitutes elder abuse. So even including tribal leaders, elected officials, um, and anyone who works, with our elders, um, and it also includes individuals like law enforcement officers or people in the medical field, um, and also those that have fiduciary responsibilities for an elder. So the list looks different. Tulalip even, I believe, even has judges as mandated reporters, prosecutors, and legal type of people. Attorneys or probation officers. So their lists within tribal codes may look different than non-tribal. Okay, next slide. Just some data, and some of this is older, but I think it just, is kind of eye-opening when you see some of this. The one that I was always just kind of shocked by was an estimated 551,000 elder persons experience abuse. Only 115,000 were reported. So that's nearly 75% of cases are never reported. Granted, this is a pretty old statistic, but I think it still happens. So even substantiating abuse can be really challenging, right? And more so now with COVID and just, a lot of our departments are experiencing a lot of staff turnover, are experiencing a lot of, staff shortages and so forth in any kind of agency or department. So that makes it even more challenging for investigations to happen as thoroughly as they should for even cases that are actually reported. Next slide. So what are the barriers to, next slide, sorry. Barriers to victims receiving help. You know, if reports aren't being made, it's like, why? What is it? Why are reports not being made? Um, so elders don't may not recognize that what's happening is elder abuse, that they are being abused or they are being exploited. Um, And just even based on custom and tradition, you know, we come from a generation or generations of people where we want to be more on the helping side, right? We want to be able to provide help. We want to be able to share what we have, what little we have often. That's kind of our teachings that guide us. And elders are also, you know, sort of following those, and they don't want to you know, impose on anyone. They don't want to, you know, create any kind of problems, especially if those people who are abusing them or exploiting them are their primary caregivers. They also may feel some shame and embarrassment to even talk about it if they are, especially when we talk about elders who are being sexually abused. One of the first cases that I had was an elder who was sexually assaulted in a nursing home in a care facility, and the person who raped this elder was a maintenance guy, and that person came in. Fortunately, well, maybe unfortunately, I don't know. This elder had a roommate in that room, and the roommate had a little bit more cognitive ability and also substantiated what the elder said that the guy who raped her, the maintenance man who raped her, had a name tag. She said, and she even drew the oval of the name tag, and the name was inside that oval. And there was such a person who worked there who was a maintenance person, and yet because of the elder's cognitive ability, she had you know, had some mental impairment, also some physical impairment. But the roommate substantiated that it was the maintenance guy, and also didn't know his name, but the elder knew his name because of the name tag. That person was never criminally prosecuted, but that opened an investigation or was part of an ongoing investigation of other similar reports. So ultimately, we were able to get that particular care facility shut down. But this is just one example of what can happen to our elders because they may not, you know, have the ability to recognize or even have the knowledge that what's happening to them is abuse or exploitation. Also, some jurisdictional problems can play a part of this, the problems and the barriers to victims reporting, that there may be a lack of formalized agreements across jurisdictions. So those need to be looked into, right? What kind of agreements does your tribe have with other agencies that have contact with our elders, and what kind of protections can they provide? Okay, next slide. This is an example of screening tools, and it's not, I think you know, we can take some of these and adapt them, but we can also just create our own. When we have reasonable cause to believe an elder is being abused, to be able to ask the kind of questions that may lead us to, you know, further testing of the elder. But these are some suggested questions that we could ask an elder. I think for me, the bottom line is it's so important that community-wide vigilance. So anyone who has contact with elders, provides services to elders, is aware that these things are happening as we speak, right? So I think that's so important, and also that, you know, the trust is there between people who have contact with elders, that if anything is happening, that the elder has some knowledge about who they can talk to about what's happening, if they're feeling uncomfortable, if they're feeling disrespected, if they're afraid, if they have fear of anyone in particular. What is that? Where is that coming from? Why are they afraid? Okay, next slide. So after a report is made, these are some of the tips and just things that I have for advocates to be aware of. Training is so important, to have ongoing training for advocates around elder abuse and the different types of elder abuse, and to be aware of their codes, and to be able to, um, you know the kind of emergent needs that elders may have, and also the non-offending family members of the elder where there might be abuse. But training for for your advocates on elder abuse, on mandated reporting, provide advocacy services to elders, prioritizing their safety. Oftentimes, it can be maybe even a spouse of an elder who's being abused. So maybe that elder can benefit from a protection order, for example, or maybe they need to be removed from the home and placed in some kind of a safe housing uh, place. I know some places have like a temporary foster care situation, or homes that an elder can be placed in. A lot of elders may not want that, right? Because elders are so accustomed to, their living situation. That's what they don't want to have compromised or intruded upon. They are comfortable where they're living. So it's difficult because when they're not safe, how do you remove them? That's where the trust comes in. The person that they trust needs to have that kind of discussion with them about why this move is important, that maybe talking to them that it's temporary, and for their safety. No, fulfill your role as a mandated reporter, and also to make appropriate referrals. Be familiar with the resources. So do your homework ahead of time to know what kind of resources are available to your elders. For those who need temporary care, who need just even more involvement to increase the number of visits to an elder, for example. Maybe create a position in the tribe for working with an elder, like an elder abuse advocate position or elder advocate, for example. Ensure culturally appropriate screening tools are available. Collaborate with other tribal and non-tribal programs that serve elders. The collaboration, I'll address that in a minute. Review your tribal codes and your response protocols. Every agency should have some, especially those that have a lot of contact with elders, should have response protocols, right? When they learn of something that, a possible case of elder abuse, what are their response protocols? And those should be written and also provided to your staff, to the staff within that agency, whether it's an advocacy program or other kind of agency. Okay. Um, Participating in elder abuse protection teams. As an advocate, I was on such a team. I was also on a child abuse protection team. So any cases that came up relevant to child abuse cases, for example, as a sexual assault advocate, we were called in to sit in on those case reviews to determine what's going to happen to the child or what's going to happen to the elder. Okay, next slide. I want to say also a word about having protective payees. Nowadays with tribes giving out per capita payments, um, there should be some kind of protocols in place to determine who's the best payee for this person, for the elder, especially if they lack the ability to really take care of their own finances. And what kind of finances do they have to begin with that they um, you know, that others have to be involved in. And that could be elders who are still living at home where they have, uh, pay their utility bills, for example, or so that there's some monitoring of, the bills getting paid, but also this elder having access to their own finances because it is theirs. These are some common cases that I've had some discussion with advocates. Female elder with severe arthritis cared for by her adult male son, which for me, even across genders, it's difficult. It can be challenging if we have a female elder who's in need of more and more physical care. Is it really appropriate for an adult male son to be providing that? And if not, who in the tribe provides that? Who can come in and provide that kind of care for that female elder? He works with he works during the day and elder is left alone during the day. She appears malnourished but seems happy living at home. So you have to ask, is what's going on here? Is it elder neglect? Is there any neglect happening? Um, when we say appears malnourished, elders start to lose a lot of muscle tone, right? Because of their maybe physical, uh, the amount of physical exercise they're getting is diminished. How does that impact their bodies and so forth? So all of these questions I think are important to keep in mind. Um, and that's where we use our screening tools to determine for someone, to be able to use those screening tools, someone who the elder trusts is so important, right? So that the elder can feel comfortable in talking about what's going on. Or is this elder feeling safe? Is this elder getting the right nourishment? Perhaps, they need to have some look at the physical condition, the doctor, who is this elder seeing for medical care? What are their vitals? How are they, overall their physical condition? If they seem to be fairly healthy, but look malnourished, maybe it's just, they need to get more good nutrition, for example. Who in the tribe provides that, right? Okay. I'm not going to go over the examples just because I want to get to the other points within my other slides. So if you want to skip over the next two examples, or yeah, skip next slide. Yeah. So this is just to the point where, there's a determination that there's services that I've been talking about that this elder needs. And this is taken from the Quileute Family Tribal Code, where it says the tribe shall access, right? I love that. It says shall access any kind of programs as appropriate to provide necessary services and resources to strengthen the ability of families to meet the needs of their children, vulnerable adults, and elders, and ensure safe and stable home environments for children, vulnerable adults, and elders. So they're saying we're going to do our best to look in the community, whether it's within tribal, federal, or state, or even private programs, to make sure that the most vulnerable are provided the needed services. And I think formal agreements even are appropriate to make once those kind of programs are determined or identified, to make formal agreements with those agencies to ensure that, when the particular tribal elders need services, that they're you don't get bogged down with all of the back and forth communication, that there's an understanding and a formal agreement already made with that particular program, that your elder is in need of the services. Was there a question that we want to address?
Hi, Bonnie. Yes, we had one question from Justin McCants. He said, hello, team. Is there a way to follow up on a report of elder abuse? He said he gave a tip of a murderous and trafficking terrorist cell phone to the Attorney General of Florida, who reported the information to Winter Haven Police in Winter Haven, Florida.
Was this regarding an elder?
Yes, it was a report on elder abuse to the Attorney
Okay,
General.
okay. Huh. Um, the jurisdiction, was there trafficking, did you say, involved?
It sounds like it was involving trafficking.
Sorry, I have a cramp in my leg. The jurisdiction there.
Sorry, Bonnie, your audio is cutting out a little bit.
Oh my gosh. How am I now?
You sound good.
Okay. Got a cramp in my leg. Oh my gosh. Okay. That doesn't happen. Um, of course, there's civil issues, there's criminal issues, right? Happening. Jurisdictions that are involved, there needs to be a determination made about, where those things are reported. If we're talking about an elder, um, trafficking can involve anyone. The primary thing that I always say needs to be considered first and foremost is issues of safety. Anytime outside law enforcement, outside criminal jurisdictions, anyone becomes involved, um, you know, victims can be targeted, so that, you know, that kind of process can be um, interfered with, because, you know, any kind of crime, there's retribution often or retaliation, or so I would be really concerned about victim safety for one. While anything is happening, while investigations are happening, what does it take to keep the victim safe from that particular perpetrator or anyone involved with that perpetrator that might come back and retaliate, or to keep that victim from further the investigation and so forth. So that would be my first concern.
Thanks, Bonnie.
So, and I'm a proponent for involving advocates. In any jurisdiction, in any geographic area, generally there are advocates. So even consulting with your local um, coalitions, there's statewide coalitions that are um, where there are advocates that can work with victims while this is all happening, to make sure that there's some safety measures in place, whether putting them in a shelter or just ensuring that they're safe, that victims are safe while this is all happening. Okay.
Thanks, Bonnie. No further questions at the moment.
Okay. So again, like I'm just saying, safety assessments should be made. Suspected abuse is reported. And I can't stress enough the importance of the safety issue, right? Um, Incident reports are taken. Um, referrals are made to law enforcement because there may be a crime here that needs to be investigated by law enforcement. And then to be able to coordinate back and forth between those who are working with the elder, from whether social services or advocacy, and also with law enforcement while this is all happening. Okay, next slide. And this is all needed information that's needed in a report. I won't go over this in detail, and this sometimes can vary, but generally this is what is in a report. Okay, next slide. Every code will have some kind of language around penalty for failing to report. You know, if you have a good, you're making a good faith effort to report, that's what's really important. And there should be some kind of documentation that mandated reporters fulfill their obligation to report, right? So documentation is really important so that there isn't civil action taken. There are also in some codes, like I just got to say, there's some codes that include any language around retaliation. So anyone reporting should not be the target of any kind of retaliation by the family or uh, anyone else for making that report. Okay, next slide. Next slide. This is really geared for anyone, but mostly for advocates, advocating for elders beyond the immediate response. Community education is so important because, like I said early on, it's up to all of us to protect our elders. They are so valuable to us, and it seems like we're losing them like every day practically. So identification, making sure that we have ongoing outreach to elders, visiting elders whenever you have the opportunity, finding out what they need, and also establishing trust. The more people that have contact with elders and have that trust, the better. Utilizing them, bringing them in as part of your program, even helping out with developing codes, your tribal codes, I think is also important. So, like giving elders a voice, um, and just utilizing their input. So, the more elders are brought out of their homes wherever possible, the better, so that there is that vigilance towards protecting them. Okay, next slide. More resources. So anywhere you have the opportunity to elevate funding and encouraging your tribal leaders to increase availability of resources, the better. That it should be a top priority. Developing MOUs with state, federal partners to protect elders, training and networking with care facilities to have presence there, to monitor quality of care. There is so much neglect happening in a lot of those care facilities. It's disheartening to see. It really is. I've seen it, and it's really sad. Educate tribal programs that have contact with elders and families on recognizing elder abuse, understand the challenges, eliminate the barriers to reporting, have elders on your boards as part of maybe an advisory council, and hold community-wide forums on elder abuse. Okay, next slide. The establishment, development of the elder abuse protection teams in your communities. So these are all components of having an elder abuse protection team. If you're thinking at all about establishing one, these are some of the ingredients to developing an EPT. Okay, next slide. And I've been saying this all along, it takes the community to protect our elders. Next slide. This is the development of tribal elder abuse codes. Convening a code development team or a committee, which, can start off as a working group made up of anyone who you think should be on that team. And like I said, when I first came to TLPI, I was like, why am I here? I'm not a lawyer. I shouldn't be here at this tribal code development training. And it became very clear that yes, anyone who works with elders, even elders themselves, can be a part of a tribal elder abuse code development team. I think that would be awesome. But people like law enforcement, advocates, anyone who works with elder services in the community, someone from social services or medical, and then uh, so that that team can be anyone. And I say, use your own language wherever possible. The Quileute tribe that I visited and helped them with their code, they use a lot of their language within a lot of their codes, including their elder abuse code. So I endorse and fully support that. Research other tribal codes. So bringing in, examples so that you have some model language, but also making sure it's based on your own custom and traditions and so forth. So it's not just simply taking a code and then, adopting it, but you can also use existing codes as examples. Incorporate tribal beliefs and values, utilize elders, research the data, include the data in your codes. It's like, having that high evidence of elder abuse happening in tribal communities, or even your own data, the number of cases that are being reported doesn't accurately reflect the number of cases that are actually happening, the chances are. And yes, you should bring on tribal attorneys to be able to help with some of the legal language. Present the code to tribal government. Um, I was a part of this code development training one time, and we had an elder who was there who was also on council, right? And she was taking notes the whole time through. And every time she had a question, she'd raise her hand, and we would, explain why that kind of language was important and how can we put it in a context that was really meaningful to the tribe. She helped with that part. She knew that domestic violence code inside and out, was just amazing. So she sat in through that whole code development training for that tribe, and she took the code, it was a domestic violence tribal code, and she took it to her tribe, and it was adopted unanimously. So that was one experience I had with a actual tribal council member who was also an elder participating in the code development. And then implementing the code, train your anyone who provides services to elders on the code as it's written. Next slide. And this is just saying, yes, utilize elders, development of a elder panel. My tribe, the Ho Chunk Nation, we have a traditional court where we have elders in that traditional court who hear cases. And we also have, as another part of that, a group called the Clan Mothers, and they work with more of the females, the adolescents that come in through court, as part of our tribal, the juvenile court, and they like the delinquency cases and so forth, and they help those young women with their problems that brought them to court. So the court may refer these young women to the clan mothers, for example, so that they can determine what's the best course of treatment and what kind of help does this young woman need. And they've had just really great success in keeping kids from going on to be involved in the criminal justice system. Okay, next slide. When we talk about essential services, I wanted to add this, that often it's not, yes, it can be, anything involved with sustaining a person's life, physical, mental health, and so forth. But I love this part in this where they include access to traditional foods and access to religious ceremonies or services that I talked about earlier. A lot of our elders, they're accustomed to our traditional foods, and any way that a tribe can provide that, I think is amazing. So I wanted to add this piece as part of uh, something to think about. Okay, next slide. This is just a quote. Our elders preserving our past in their memories, influencing our present when we dare to listen, aiming us toward our future, rooted in their wisdom. They deserve our respect, not our abuse. This is from the Laguna Pueblo and their elderly code. Okay. Next slide. These are resources that were added. I think they are excellent resources. I've used a couple of the slides from the Native American Elder Justice Initiative, interactive map of elder abuse codes by state. I've used some of their information. They also have a toolkit. I think it's listed lower, the NAEJI Tribal Elder Protection Team Toolkit. I think I've used some of their information in this webinar. I just want to warn you that some of the links are broke when you look at the examples of the elder abuse codes. So where they have a map and then you click on the state that you want to look for tribes that have tribal elder abuse codes, some of those links are broken, just to give you a little heads up. All right, let me turn it back over to whoever for any questions. Catherine?
Thanks, Bonnie. And now I just wanted to give an opportunity to see if anyone else had any further questions. And like Bonnie mentioned, we did share a link to the Native American Elder Justice Initiative in the chat. And thank you, Peggy Jo, for joining us today. We also shared that they will be having a Tribal Elder Abuse Code Summit in 2025. And that link was shared as well. We'll also share in follow-up email to attendees the links to the resources shared in the slide as well. Okay, and if there aren't any further questions, we can move to the next slide, please. Perfect. Thank you so much, everyone. And thank you, Bonnie, for joining us today. I just want to thank everyone once again for joining today's webinar titled Strengthening Tribal Codes, Integrating Victim Advocacy and Elder Protections. And the webinar was recorded and will be posted on walkingOnCommonGround.org and will be sent out to attendees as well. And I will also want to remind folks that this webinar is a part of a series of monthly webinars to support the development and enhancement of tribal courts, tribal justice systems, and intergovernmental collaboration. These webinars are brought to you by the Tribal Law and Policy Institute, the National American Indian Court Judges Association, and the Tribal Judicial Institute, UND School of Law. I want to also let folks know that for the month of February, TLPI and NIDRA will host 2 webinars as part of our Empowering Justice webinar series that will focus on providing resources for pro se litigants and tribal court judges. The first webinar is titled Innovating Access to Justice in Tribal Courts, Emergent Supports for Pro se Litigants and Judges, and it will take place on Wednesday, February 5th at 10 a.m. The second webinar is titled Empowering Tribal Courts Through Self-Help Resource Development, and that will take place on Wednesday, February 19th at 11 a.m. Pacific Time. Registration links for each webinar are available in the chat and will be shared with attendees by email as well, along with today's webinar recording and materials. And as a reminder, there will be a link for the evaluation in the chat box as well. And you can also utilize the QR code on the screen. So please take a moment to complete the evaluation. Your feedback is greatly appreciated. And thank you all again for joining us today. And we look forward to seeing you next month.